Hello everyone. So in this video, we are going to discuss treatment refusal approach. And treatment refusal is a really common topic because it's really common. It's a really common problem in real life as well. So you get a scenario where you have a patient who is refusing some kind of treatment or procedure, or he's refusing to be hospitalized. So how to how to deal with such patients and what should be the approach? What is required of you in these stations? Okay, so first of all, when you get a scenario where a patient is refusing some kind of treatment, so to start the station, first of all, is you are seeing this patient for the first time. Like this patient can be in contact with medical services for a long time. He might be diagnosed with some condition for which he is now refusing some form of treatment or procedure or getting hospitalized. But for you, it's really the first time that you are seeing him. Okay, so you need to when you start the station you should start with the phrase that I have heard that you have some concerns, or I have heard that you do not want to take this treatment, or you do not want to be in the hospital, you want to go home. But can I just ask you a few questions just to make sure that we are on the same page, because I'm seeing you for the first time. Okay, and then you ask the reason for admission. Okay, so what symptoms did you have when you were brought to the hospital? How are you doing now? Okay, or you can ask, if he's not admitted, then you can ask, what symptoms did you have when you were diagnosed, and how are you doing now? Okay, so you check the current symptoms of the patient as well, if he is out of danger and red zone at the moment. All right, and then a short history about any other medical conditions that the patient might have, any allergies, and any medications. So MAM stands for basically medical conditions, allergies, and medication. And then social history. Social history is really important. So you should ask the patient, who do you live with? Do you live alone? Can you do all your house chores on your own, etc. Okay. Social history is really important because if an unwell patient is going back home, then you want to make sure that there is someone at home with him, and he's able to do his activities of daily living. Okay. So you will ask these four questions: the reasons for admission, symptoms at that time, current symptoms, any other medical conditions, allergies, medications, and social history. All right. Now come towards the treatment refusal. So the first question that you need to ask this patient is why. Okay. So you need to ask this patient, can you please tell me why are you refusing this treatment? Why do you want to go home? Um, why you are refusing to do this procedure? So the first question is ask why. Okay. And explore the patient concerns. Why? Is he scared of the treatment? Is he scared that it's going to be too painful? Or is he scared of some side effects of the medications? Or is he scared of some side effects of a procedure? Is it something that he has read online? Okay. Or is it, or he doesn't want to get hospitalized because he doesn't like hospitals, because there is some trauma associated with the hospital. Maybe some of his loved ones, maybe it brings bad memories. Some of his loved ones, maybe, they might have died in the hospital. Or is it because of some responsibility? Is it because they have a child at home, or they have a pet at home? Okay. So you need to explore the patient's reasons, and you need to acknowledge the patient's concerns. And you should tell them that I understand where you are coming from. I totally appreciate that you do not want to stay in the hospital. And try to offer solutions, okay? But start with the least costly solution, okay? So, for example, if he has a child at home, then you can tell the patient that how about you ask your friends and family to take care of the child, and if not, if that's not possible, then you can go towards nursery or other options where the patient has to pay. Okay, if he has a pet at home, then you can tell him that if some of the friends or family can take care of the pet. But if he says he doesn't have any friends and family, then the other options that you can tell him is that the local council in UK, the local council has a duty to take care of the pets when the owner is hospitalized and there is no one to look after the pets. But the charges of the charges of the care that they provide to the pet, that must be paid by the patient later on. Okay, so you need to tell the patient that regarding your pet, regarding your dog or your cat. I am aware that the local council has a duty to provide care to the pet, although the cost that is involved must be later paid by you. But if you want to consider this solution, then please contact the council services regarding it. Okay. So the main thing is ask why, explore the patient's concerns, acknowledge the concerns, don't be dismissive. Okay. And offer solutions and start with the least costly solution. Okay, whatever solution you can think of. Patient can present with diverse social problems. Sometimes you might not have a solution for their problem. So, that's totally okay. If you don't have a solution for their problem and they want to go home, then you need to just follow this approach. Okay, some of the candidates think that they must convince the patient or they must provide a solution. That is not expected of you, because in reality there are a lot of different social problems and you don't have solution for every problem, but you just need to do your part of the job. So at least don't be dismissive of their concerns and try to offer some sort of solution that you can, and if you cannot, then just move on with the rest of the station and follow the procedure. Okay. So if after offering solutions the patient still declines and he says that no, I still want to go home, or I still do not want to take this treatment, or I still do not want to do this procedure, then what you are going to do is you're going to explain the risks versus benefits. Okay, so just going to tell the patient that how about I tell you the risk involved if you go home at this moment or if you don't take this treatment. Um, and also I will explain the benefits, and after this we can have a chat. Okay. So you explain the risks. For example, if the patient is admitted with pneumonia, severe pneumonia, he's receiving IV antibiotics and he wants to go home, then obviously you will tell him that we are giving you these IV antibiotics through your vein because they have a good penetration inside your lungs and they will control the infection quickly. But if you go home now and you are not able to take IV antibiotics then, and you take oral antibiotics, then there is a chance that the infection might worsen and pus might develop inside your lungs, and even your lungs can fail, and it's called as respiratory failure. And it then you might need you might not be able to breathe on your own, and you might need a ventilator or a breathing machine. Infection can spread to your blood, which is called sepsis. And when infection spreads to your blood, then your blood pressure can drop to dangerously low level and it can be life-threatening. Okay. Similarly, if the patient doesn't want to do any procedure, then you explain the risk associated with the procedures and the benefits of the procedure. So explain all the risks and all the benefits, okay? But if the patient still refuses, after explaining the risk and the benefits, you should ask, so how do you feel about receiving, the treatment or going home? At this point, if he still refuses, then tell him that fair enough. You have all the right to take whatever decision that you want for yourself, but I just need to ask you a few questions. Okay. So after this, you need to check capacity. So this is the second part. So the first part was asking why. Okay, why why is he refusing the treatment? Okay, and then exploring concerns, offering solution. If he still refuses, then what you do, you explain the risks versus benefits clearly. Okay, if he's presented with some infection like pneumonia, you explain the risk versus benefits clearly of going home at this point. Okay, if he has cancer and doesn't want chemotherapy, you clearly explain what will happen. If he is, admitted with some other infection like endocarditis, then you explain what will happen if he goes home. And we clearly explain the risk versus benefits, because the patient, he doesn't know what actually the risks are and what are the benefits, but it's your job to tell him. Okay. If he still refuses, then you are going to check capacity. So checking capacity, there are basically four domains of checking capacity. Number one is understanding. Number second is weighing the information. third is recall, and fourth is communication. So understanding, weighing, recall, and communication, we must check these four domains to label a patient competent. Okay. So at this point, I would like to tell you that what most candidates do is they don't come to this point at all during their consultation. So if the patient keep on refusing till the end of the consultation, they will keep on providing solutions, and sometimes they only have maybe two solutions or three solutions for their problem, and the patient has refused all the three solutions. So they will start repeating the solutions again. So how about this and how about that? And they will, they will keep annoying the patient and keep telling the solutions, but they will not check the capacity. So if the patient keep on refusing, this is because the examiner want to know whether you can check capacity or not. Okay. So the main task here then become checking the capacity and not convincing the patient. So, be careful about that. Okay. So how to check capacity? So the first domain is understanding, where the patient understands why he's here and what's going on. So you would ask the patient, can you please tell me in your own words, why were you admitted to the hospital in the first place? Can you please tell me in your own words, why are you receiving this treatment? Can you please tell me in your own words, why you were offered to do this procedure? Okay. So this is basically checking the understanding of the patient, then weighing the information, weighing the risk versus benefits. Remember, you told him what are the risks and what are the benefits. So now you are checking whether he really, he can weigh the pros and the cons that you have already told him. So we'll ask him, so after all this information that we discussed, how do you feel about not receiving treatment at this point? How do you feel about not doing this procedure? Or how do you feel about not staying in the hospital? Okay. So after this, you are going to check recall, whether the patient has any memory problem or not, or is he able to recall what you have already told him. So how would you check recall? You will tell the patient, before knowing your final decision, Mr. X, I would like to make sure that you remember the important points from our discussion. Can you please tell me what are the risks associated with not receiving this treatment? Okay. So that was checking recall. And the final step here is checking communication. So the patient must clearly communicate to you at the end that he does not want to receive this treatment. So you should ask him, Mr. X, I would like to hear your final decision regarding not receiving this treatment, or I would like to hear your final decision regarding going home. Okay. So now you have checked the capacity of the patient, whether the patient has capacity or not. Okay. The third point is checking mood and societal risks. So for example, if the patient has a long-term, a long-term chronic health condition, then you might think that, okay, this patient does not want to receive treatment, or this patient does not want to be in the hospital and against the medical advice, knowing all the risks and the benefits. Is it because he's suicidal? So you need to check the mood of the patient and suicidal risk. You don't need to do the full suicide risk assessment, just check the mood. So you can ask, can you please tell me how your mood has been lately? And if the patient has a chronic health condition, you can say that, you have this condition and it's been, and you've been having this condition for a long time now. And sometimes, when people have long-term health condition, and their mood is low, they sometimes think about harming themselves. Has this ever been the case with you? So you just check their self-harm risk. And if there's self-harm risk, so after checking the capacity and the mood, you have basically two situations. So you have two situations here, situation A and situation B. So in situation A, the patient has capacity, okay, and his mood is okay. There is no risk of self-harm. So what you are going to do in this case, you will tell the patient, fear not, Mr. X, I will let my seniors know that this is your final decision for now, and we'll prepare your discharge slip, okay? So you'll tell them that, I'll let my seniors know that this is your decision for now, and we'll prepare your discharge slip. So this is basically, you are being safe here. So you're telling him that, okay, I've checked your capacity. You're showing to the examiner that you know how to do capacity, and this patient has the capacity and his mood is okay. There is no risk, and he is a competent adult with capacity. He is the right to go away, but still I am involving my seniors. I'm telling them that this is the patient decision and should we prepare the discharge slip. Okay, just to be on the safe side. And then you are going to safety net this patient as well. So he's not willing to receive treatment now, but you are going to safety net him and you are going to tell him that if you go home and your condition worsens, then please do not hesitate to come back. You can always call 999 or come to the emergency department if you are not feeling well. Okay, so please safety net him and tell him that please do not hesitate. If you have to come again, okay. And uh, the second situation, the situation B, is patient does not have capacity. So it can be because of any reason. It can be because of dementia. Either the patient has memory problem, or the patient is schizophrenic, or he is depressed and he is actually suicidal. Then what you are going to do? You're going to tell the patient that unfortunately the problem of dementia or the memory problem, in simple words, your memory problem or your mental health condition or your mood disorder is not helping you to take the best decision at the moment. So I will inform my seniors about this as well, and we'll have another chat with you. So, okay. So basically, if the patient refuses treatment, then you need to do three things. Initially, you will just ask the symptoms at presentation, then the current symptom, how is the patient doing? Is he out of the danger zone at the moment? Medical conditions, allergies, medications, and social history. Okay, this is your data gathering. And then you need to do three things. Ask why, explore the patient concerns, provide solutions. If still refuse, then explain the risk versus benefit, check capacity. If still refuse, then just, check the patient's mood and suicidal risk assessment. And then depending upon which situation you have, you tell the final management to the patient. Okay. And in some situations, the patient, after you explain the risk versus benefit in a good manner, then he might agree with you and he might tell you that, yes, doctor, I want to take treatment, or I want to stay in the hospital. And then you should appreciate him for this. Then no need to check capacity and do all this stuff. Just appreciate him for taking good decision, and answer any other concerns or any other questions the patient might be having. So this was all about treatment refusal approach. I hope it was helpful. And if you find my videos helpful, then please like or make a comment under the video, interact with it in some way, subscribe to the channel so that it can reach to more people who might need it. Thank you so much, and I will see you soon in the next video.